Hello, and welcome to the Illinois 6th Congressional District Democrats Town Hall on COVID-19 and healthcare. We have an amazing panel today that's going to talk with you about the effects of healthcare of the COVID-19 on our healthcare system. My name is Patrick Watson, and I'm one of the co-chairs of the Illinois 6th Congressional District Democrats. Our role as the Illinois 6th Congressional Democrats is to help elect Democrats up and down the ticket all throughout the 6th Congressional District. You're going to hear from a number of professionals today that also happen to be candidates across the district. I want to introduce you now to my other fellow co-chair, Nancy Shepherdson.
Hello, everyone. We're so glad you're here. I'm very excited about this panel too. I really want to hear what we can do to cope with COVID and what the government should be doing for us and what the ideas of our panel are tonight. So I'm going to waste no time in introducing Jennifer Zordani, who is also running for state representative, and I'm going to get this wrong, District 41? 47, okay, down in the Clarendon Hills area. And she is going to be our moderator for tonight, and I will let her introduce herself as she wants to. So thank you so much, Jennifer, and all of our panelists for being here tonight.
Thank you, Nancy, and thank you, Patrick. It's really a service that you're doing to the residents of the 6th District, connecting them to candidates and information on COVID-19. The 6th District is a district represented by Sean Casten. He's our congressman. And so all of us who are here tonight are in at least part of Sean's district. Our panel tonight is Dr. Amin Nadeem, and he is a critical care specialist who practices at the Captain James Lovell Federal Health Center, Federal Health Care Center. And our other panelists are the candidates, Maggie Trevor, who's running for our Illinois House District 54. And the towns in that district, there's multiple towns in each of our districts, but Maggie's districts include, towns include Rolling Meadows, Palatine, and Arlington Heights. Maggie's website is Maggie Trevor 4, the number 4, il54.net. Okay, so if you Google all of the candidates, you'll be able to find information. The next panelist is Marcy Sulzer, and she's running for Illinois House District 52. And her towns include Barrington and South Barrington and Cary. And her website is voteformarcy, with an I.com. Our next panelist is Suzanne Ness, and she's running for State House District 66, which is just to the west of where Marcy's district is. And Suzanne's towns include West Dundee, Carpentersville, and Algonquin. And her website is citizensforsuzanneness.com. And our final panelist is Jennifer Banek, who is running for Lake County Coroner. And her website is banekforcoroner.com. Jennifer is a nurse, and Dr. Nadeem and Jennifer as a nurse give us the opportunity to say thank you very much to our healthcare providers for being on the front lines of what is the biggest health event we've ever seen in the United States. So without further ado, I'd like to have Dr. Nadeem speak to us about some of the basics of COVID-19, the direct effect on us as patients, and a little bit about what we've learned over the last 6 months, and as we're heading into the fall, why we should not think of this like the flu. It's more serious than the flu. So, Dr. Nadeem.
Thanks, Jennifer, and thanks for providing me with this opportunity to join this wonderful panel of the people. So I'm going to talk about COVID-19. I'm going to talk a little bit about the history and moving forward, what it can do and what it has done so far and what we have learned so far. As all of us know that in this disease started from, this is no novel coronavirus. It's called SARS-CoV-2. It started with a cluster of cases of pneumonia in Wuhan, which is a city in Hubei province of China. As a matter of fact, one of the physicians who first time warned about a mysterious illness, Dr. Li Wenling, and he's one of the unsung heroes because he was the one who first time warned about that something suspicious, very unusual type of pneumonia cases being reported in Wuhan with a very high mortality rate. And actually Chinese government admonished him, and later he contracted the illness and died from it at age of 33. So just from get-go, a disease which is killing a 33-year-old healthy man, just for all of our participants to understand the impact of this disease. And then it spread pretty quickly in Wuhan city and Hubei province. And the Chinese government took very drastic measures and lockdown, and they were able to contain it after spread locally. And then it did not affected the other cities the way it did Wuhan. But unfortunately, the disease got out of the China and it spread to other countries, including Western Europe, countries in the Western Europe, and finally to United States. In the world, in February 2020, World Health Organization designated the COVID-19 as pandemic. The reason it has spread so quickly, there are several reasons. The first reason is that it's extremely highly contagious. The second thing which I want everybody to understand, we had H1N1 and influenza outbreaks in the past. When people get sick with H1N1, which is a type of influenza virus, they get sick and they cannot go out and spread the disease. There are not enough asymptomatic disease. There are not enough asymptomatic patients with influenza or H1N1. So if somebody gets sick with H1N1 and they are not severely ill, they are still staying in the at house because they are running fever of 103 and they are having severe headache and they are having severe myalgias, so they cannot go. Unfortunately, this disease, there are up to 40% of people could be asymptomatic, could carry this virus and spread it. And I strongly believe that's one of the reasons that this disease has got out of control. So if you think about it, it's a big responsibility. What if you are an asymptomatic carrier? So how do you take a responsibility of not spreading it to the other person? Right now, with the pace we are doing tests, we are not going fast enough. We are not doing enough tests, and it will take a pretty significant effort to test a significant number of population. So in the meantime, what we have learned is by using mask for yourself, and if everybody put the mask, it can significantly decrease the spread of the disease. And the use of mask should not be a political issue. It's not. I mean, it's a virus. I mean, how can we say a virus will not affect certain parts of the country and will affect other parts of the country? So about COVID-19, it spreads by person-to-person transmission. It can also go from human beings to animals and animals to human beings as well. So if your dog is sick, you have to be cautious about it. And the disease can range from from asymptomatic, which is you don't know you have disease, to mild disease, which could be just like cold-like illness with the coughing, sneezing, and low-grade fevers and headache, could be very severe disease with pneumonia. Let me just explain you when I say very severe disease, because I'm one of the ICU doctor, and I took care of quite few number of COVID-19 patients. And the patients we saw, even those who survived, many of them are in nursing home. They got sick in May they're still getting rehab because it has damaged their lungs to the extent they cannot even walk 10 feet without getting short of breath. One of my close friend of mine, he was my age. He was working in UA as a trauma surgeon. He contracted the disease, was in ICU for 3 weeks and passed away. And he has no underlying disease. He has no chronic conditions. So this notion that somehow if you have underlying diseases like hypertension, diabetes, or cardiovascular disease or pulmonary disease, those are the people only need to watch out is not true. We have lost quite a few young patients, although the people who tend to get severe disease and tend to pass away tend to be older. And it's the mortality rate is lower in the younger patients, but it's yet still there. So the combination of the fact that it's a highly contagious disease, it spreads from person to person through respiratory droplets, and in some cases there is a talk about it could be airborne, depending on how much the person is sick. It could rapidly go from one person to other person. Few things which we have learned is if you are around somebody who is sick and has active symptoms, your chances of getting sick depend on whether that person is wearing the mask, whether you are wearing the mask, and how much close proximity you are to that person, and also by the fact that how long you are in contact with that person. So as everybody know that many healthcare workers have passed away because of this disease too, and they contracted it from their patients. I've been practicing medicine in this country for the last 26 years. And I personally, here or anywhere else, have not seen such a highly contagious disease which affects population that way. But, these are the things we still have. So I want to talk about a little bit about hope. We can still contain this disease by doing our part. And all of us has to work together on that. So what do I mean by doing our part? When we go out, we should follow social distancing. We should be wearing masks. We should be washing our hands frequently. If we, God forbid, get sick, it's our responsibility to isolate ourselves to save other people. And it's also our responsibility to go ahead and contact the healthcare authorities about our possible contacts so they can be tested. So if we do all these good practices and the public health departments have more proactive approach throughout the United States, we can still get it under control. The good news is that there are many new treatments which have improved the mortality and outcome. So what I mean by that is if somebody has to get sick now and has to go to hospital, they have less chances of dying as compared to May. But I still want to run a number so everybody can understand how serious it has been. We have a study on about 2,700 patients who were hospitalized with COVID-19 in New York healthcare system. 24%, 665 patients died. This is not flu, folks. Flu has much lower mortality. I have taken care of flu patients off and on for the last 26 years. When I get a patient with flu, I never think that this person could die. We know because we have extensive experience with flu and there are medications, there's vaccine. We know we can get that patient better, but we don't feel about that for COVID-19. And the patients who survive in this study, many of them are still disabled. They cannot go back to work. They cannot function because of damage done to their lungs. So having said that, yes, it's a very serious disease, but we can do our part and we can still control it. Thank you so much.
Oh, thank you. Thank you. That's a terrific overview, sort of where we began and where we are, how serious it still remains. If we could turn to Marcy, and Marcy, if you'll give us a little bit of an overview or insight into what the mental health situations, you're seeing, or in our communities we're experienced not necessarily because of COVID-19, but are maybe exacerbated by COVID-19, and what resources are available.
Okay, thanks, Jennifer. As a mental health professional and someone who focuses on crisis care, trauma, suicide risk and prevention, anxiety, depression, the COVID-19 pandemic has presented some very significant challenges to the mental health community, both the people who are living with illnesses and the people who love them and the people who care for them. The impact of COVID really is going far beyond the numbers of physically ill hospitalized patients, but that's also a group that needs to have mental health support. If a young, healthy person is now being told that they have to have an oxygen tank with them for, we don't know, maybe 3 months, maybe 6 months, that is a tremendous loss and impact of grief. Even if their lives have been spared, their lives have been altered, which means that mental health counselors can step in and play a role in that. Mental health issues, unlike the physical symptoms, are often completely invisible. And lots of different cultures still have a lot of stigma around admitting to mental health issues. The people who have never had a mental health issue before are now experiencing symptoms that they just might not know what to do with. People who already have symptoms are often seeing them increase. If we were in a room and I was talking to everyone, I might ask for people to acknowledge in some way if, since they first heard the words pandemic and shelter in place, have they felt more anxious, more insecure, more uncertainty? Have they felt isolated from their friends and family? Have they missed out on significant events in their lives? The birth of a grandchild, attending the funeral of a beloved aunt, so many tiny little hits on our psyche that people who've never worried about food scarcity before, all of a sudden were panicking that there wouldn't be enough meat at Jewel. They were experiencing a lot of the traumas of people in refugee situations and similar situations where they've been removed. So those factors have all really contributed to a rise in mental health symptoms. In fact, I was astonished. I'm only going to share two figures with you. In January through June of 2019, so about a year ago, 11% of the population was reporting either depression or anxiety or both. In 1 week, May 14th to 19th in 2020, that number had gone from 11% to 34%. Substance abuse, some of the workers in the substance abuse field are calling the pandemic the national relapse trigger. In fact, DuPage County was featured in an article recently because they declared a public health emergency due to the uptick of both overdose deaths and overdoses. And of course, domestic violence and interpersonal violence, there's always risk in fleeing a domestic violence situation or in reporting suspected child abuse. But now, without the safety nets that were in place being able to be brought to bear so quickly, it is becoming even more perilous for people in that condition. Luckily, we live in a state where the current governor, Governor Pritzker, is taking mental health more seriously than previous administrations, which slashed our funding. They have expanded telehealth And that's brilliant both for primary care doctors diagnosing things like cuts, scrapes, rashes, and bruises, but also for mental health professionals. It's been a real shock for a lot of my colleagues to do Zoom meetings. We've never really done that in our profession. And the challenge of doing play therapy via virtual is an interesting challenge that lots of professionals are now stepping up to handle. We've also luckily had our long-term care facilities, the two that I'm most familiar with, Rosecrans and Gateway. They have special triaging when they bring in people who need intensive outpatient care or inpatient care to make sure that they don't get a contagion or a cluster in those. And they're also, thankfully, an expansion in medicated assisted treatment that doctors can now prescribe without being face to face, and they are able to, in their professional judgment, prescribe things like methadone and Suboxone for longer than the daily dose. Normally, if someone was on methadone until they were stabilized, they would go in daily to get their dose. Now they're able to evaluate and send at least a percentage of people home with doses up to 14 days or 30 days, depending on the condition and the stability. So we see a lot of things going on. There's a lot of things that we still need to do. We need to ramp up mental health crisis funding. We need to make sure that Narcan, naloxone is available readily to anyone who may need it, whether they know that their loved one struggles with opioid abuse or not. But that's pretty much it. And I want to be mindful of everyone else's time, because I'm sure, like Dr. Nadeem, I could talk about this stuff all day, but I won't.
Well, I feel like a lot of the issues we're talking about, we could do an hour. We have a lot to cover. We have a lot that, you know, we set an ambitious agenda, but we could spend an hour probably on every topic. Thank you, Marcy. Jennifer, as a nurse, can you give us a little bit of insight? Dr. Nadeem talked about masking. He talked about the preventive steps. Are you seeing anything in your scope of work where you're saying this is really what's incentivizing people to mask? Here's ways that people are learning to mask better or just comply better with slowing the spread.
Hi, thanks, Jennifer. Yes, my name is Jennifer Banek. I'm an advanced practice nurse. I have a master's degree in nurse anesthesiology. So putting people to sleep is what I do on a day-to-day basis. But we're not going to put anybody to sleep today. I'm going to keep within my 2-minute time frame. You know, I think in terms of incentivizing, I think in the beginning, I think there was I think we lacked in some areas in terms of messaging. I think that public health departments and the state have ramped up their efforts and done a little better. You know, as candidates ourselves, we know how important messaging is. People need to hear the same message over and over again. You know, one of the nuances or concerns about this is that there are, you know, this is changing constantly. We're on the precipice of starting school, and pediatric patients in particular, you know, are affected very differently by this virus depending on their age. So there's lots of data that's evolving, which makes messaging more difficult. You know, as was mentioned before, we're fortunate to have, go ahead.
I was going to say, are you seeing campaigns up in your neck of the woods like we are in our area, the thank you for masking and things like that?
Yes, absolutely. Yes, absolutely.
Yeah. Good.
Yep.
Good.
So I think it's important for businesses, you know, to support this initiative as well, to have signs in their windows so that folks going into businesses feel welcomed, you know, wearing their mask and know that they're being safe and they're protecting themselves and they're protecting other people. So super important, absolutely.
Thank you, thanks. Suzanne, you are a McHenry County board member. And will you talk a little bit about what you've been doing at the county and then what you think about as well for messaging and getting people to get their tests and things like that?
Sure. Thank you for having me tonight. Yes, when this all first started and happened, because of the emergency order and the emergency response, there was an joint information council that was created, it brought partners from all over McHenry County in this sort of daily briefing led by our emergency management folks. And initially it was just really out to kind of those emergency, what do they have to do right away. But we quickly created a COVID resource website dashboard on our website, and then started to track traffic to it, put it right on the homepage. And that was one of the best things I think we did from the get-go. Then we were able to see through that site what were the things that people were asking for the most. And as information came out, it would cover more areas. So we had congregate living facilities added, healthcare, testing, the daily count. People could go right to the dashboard and see what was happening in McHenry County. So that was all really effective. And then it really morphed into that. I was thinking about this as I was listening to everybody talk. This has been an evolution, right? What happened, remembering those first 30 to 45 days when we were all in that sort of, whoever said it about the meat at the grocery store, Marcy. Yeah, it was really intense. So then it got more refined. We started something called Restore Illinois, or Restore McHenry County, or Restart McHenry County, as an effort to start to look at ways that we could, as a region, when we started reopening, to target messaging to different industries. What we have now is social media, an active social media campaign, public service announcements. We sent out special targeting to restaurants and bars last week to really include their cooperation. And incidentally, Lake and McHenry counties, since we're a region now in the state, we've combined forces. Our public health departments are working together to use that messaging together. So we've shared some resources that way as well. So yeah, but you can't do enough, right? When it comes to communication, I feel like.
Yeah. Excellent. Maggie, in your neck of the woods, what are you seeing in terms of outreach, maybe particularly from the business side? Are you seeing different avenues to help businesses like restaurants or manufacturing in your area?
Yeah, well, there are a lot of resources that are available to businesses from a lot of the sources that have already been talked about. The Illinois Department of Public Health has guidelines for businesses. The Cook County Public Health website also has those, as well as there's been a lot of input from associations as well. Illinois Manufacturers Association has resources. The Illinois Restaurant Association has been working actively with the Department of Public Health and the governor to develop those as well. But I think one of the keys in this particular area has been, as far as I've seen, is a willingness for the local governments in this area to work with businesses to make accommodations so that they can satisfy those guidelines. And like a good example is downtown Arlington Heights, where the village council approved a closure of Campbell Street and Vale to allow that cluster of restaurants in that area to have outdoor dining in a place where there wasn't enough room on the sidewalk. And I think that's and each of the villages in the area has the on their websites, numbers that you can contact if you're a business owner. And I would strongly encourage everybody in that situation to do so. It's important to know that the local governments here, it's in their interest to work with businesses to keep them open. If your business closes, it's a tremendous loss to the community, both in terms of the tax base, as well as the quality of life in our area. So my first, if I were in this situation, my first stop would be my local elected official, alderman, village board member, to see what accommodations might possibly be made for my business in my area.
Excellent. Marcy, your area, are you seeing anything different than what we've talked about here? I know I'm, on the south end of the 6th district, and I live in a smaller village, Clarendon Hills, open the streets, like Maggie just said, to let our restaurants to have outdoor seating. The town next to me, Hinsdale, did the same thing. That's my district. So we're trying to make these accommodations. Are you seeing anything different than that? Yep, Marcy?
In my,
Oh.
are we good? In my communities, we really are lucky in that most of our restaurants already had some outdoor seating. We have wide sidewalks in one of the towns. I did notice that there are a lot of the restaurants have turned parts of their parking lot into really nice dining areas, and you'd be able to use social distancing. I know that the hair salon that I go to has staggered the hours. Most hair salon stylists are independent contractors, so they have more staggered hours, so there's more space between each of the stations. And when you come in, they still do walk-ins if there's an opening immediately. You can't just hang out there waiting. They do your temperature with the remote, or the remote thermometer. Yeah. And they also have you fill out a questionnaire. And of course, everyone is masked. So I think that a lot of the villages are having good compliance with the masking. I was down in another part of my district on Tuesday, and I noticed that, with the exception of people who were actually dining, everyone was wearing masks when they were in the business. So, and the tables were nicely spaced. It's actually, in some ways, I think it might be a bit of an improvement, because there are some places where you were like so packed in, you were afraid to say anything other than "nice weather, isn't it?" to your companion, because 40 people were going to hear your personal conversation.
Yes, yes.
So.
Well, I know our restaurant owners want to get back to those days where they can pack us in, and I'm hopeful for those days as well, even though I'm of that age where I want to hear the people with me also. So let's turn the topic a little bit and talk about where we are in our state in terms of testing. Because from my perspective, I remember when this first started, I thought, from talking to a medical person that I knew, the goal was going to be ramp up as quickly as possible to get point of care testing and rapid results. And we're obviously not there. So Dr. Nadeem, do you want to lead us off on what we should have in terms of expectations on testing and how we might improve it?
Sure. It's a great question. See, testing by itself is not enough. And the turnaround time for the test results is not good enough. Because let's say if you test a person today and he or she gets the test result after 72 hours, and let's say it's positive, and that person is still going around. So the most important thing is the turnaround time, and then also contact tracing. You need to have an army of people who do the contact tracing. I'll give you an example. In Bangladesh, which is like a third world country, they almost eliminated TB, tuberculosis, by army of people who went around, treated people by direct observed treatment and also contact tracing. They actually, the government hired those people. So it could be easily done. If the turnaround time for the testing improves and there are army of contact tracers, we can get this thing under control in 8 to 12 weeks.
How do we turn around the turnaround time though? How do we improve that?
Yeah, so we have rapid testing available in the hospitals where we can get the report in 45 minutes. There are some limitations because the machines which do rapid tests can only take certain number of samples, but then the technology is changing. Now we are getting machines which can do higher number of tests. So the government has to incentivize the private labs who are doing this testing, who can actually do the rapid testing. Otherwise, without contact tracing and without turnaround time, just doing tests actually is kind of silly, to say at least.
So at least we get some information. I'm not going all the way to silly, but I see what you're saying. It's certainly not nearly as effective as it could be. So
well, yeah, it could be much more effective, especially in a country like United States.
Yes, yes.
One thing I noticed out on the Lake County site today is that they are actively hiring for contact tracers. So maybe the government's, and Suzanne, you probably know much more about that than I do from just looking at the website. And I also know that some of the inpatient facilities are doing their own testing and quarantining or isolating until the results come back, usually in 48 hours.
Yeah. Jennifer, you have some very unique experience in terms of having served in our military service. You have the nursing background. Are you thinking at all about the logistical aspects? Have you looked at the contact tracing and at all in your neck of the woods?
Yes, thanks so much for the question. So, yes, you mentioned my military experience, and so I'd like to, absolutely recognize, the thousands of military personnel that are out there right now. So I returned from the Middle East the end of January of this year, and really by the skin of my nose, kind of dodged the pandemic in terms of it affecting my deployment. My husband is actually currently deployed overseas in the Middle East. And I bring this to folks' attention because, like I said, there are thousands of military personnel who their time away from their family is being affected because they're having to be quarantined for extended periods of time. And, let's not forget that we are fighting a war over in the Middle East. And so once we have folks that are deployed over there, it's easier to keep them in theater than to bring them home. So this is a demographic or a population that I think is probably going unrecognized in terms of the sacrifice that those folks are making. So yes, yeah, I absolutely agree. I will say on the civilian front, I am an independent contractor, which means that I practice at a number of different facilities in Wisconsin and Illinois. And I will tell you that it's quite interesting to see the disparities in how patients are being tested for elective surgeries between Illinois and Wisconsin. I have some facilities that patients are not being tested at all prior to coming in for elective surgeries, which is very concerning. And I have some facilities that are doing what they should be doing and having patients test 72 hours prior to and then self-quarantining, which is obviously much more appropriate. So yes, a lot of disparity in care just from one person's perspective.
Thank you. Thank you for your service in so many ways. Yes.
Absolutely, I'm honored to do so. Thank you.
Yeah. Maggie, do you want to bring us a little bit of insight on the healthcare marketplace and what we're seeing in terms of insurance and providers, our hospitals, and particularly if we have providers that are in communities that are underserved? I want to talk about what we're seeing from that perspective.
Yeah, there are a number of things going on. I think that one of both from the perspective of people who are seeking healthcare and the providers that are serving the communities. COVID has thrown a sort of a monkey wrench into the healthcare system not only in Illinois, but in the country. A lot of the care that people who are dealing with the financial end of healthcare have a certain expected mix of services that their facilities are providing. And what COVID did was to turn that all on its ear. So for instance, one of the things that we've heard a lot about is the postponement of elective procedures, things like joint replacements. And the way that our current healthcare marketplace is structured, hospitals, clinics rely on that kind of service to balance their books, essentially. So that a lot of the care that helped keep the lights on and the rent paid, they could no longer provide. And it's not just hospitals doing knee replacements. There's a system of federally qualified health clinics in this country, in this state, that primarily provide service to people who are lower income on Medicaid. They also have to balance their books, and they do that largely by providing primary care. A lot of that primary care stopped. So for instance, people weren't going for regular checkups or for mammograms or things like that during that period. And that really hit those clinics hard. And on top of it, a lot of the clinics in this country were not eligible for some of the provisions that kept employees on the payroll through the CARES Act. They were explicitly excluded from that. There have been some federal efforts to provide funding to make those clinics whole, but they're still suffering, and as are a lot of the healthcare entities in this state. And it's going to take a while for them to kind of get back on their feet again. And part of that, I think, speaks to something that maybe we can talk about later on, and that is how we reimburse care in this country, and why certain types of care for people with certain types of insurance are more profitable or less profitable. But the reality is that we have to get through this crisis. And right now we do have a situation in that the places that have been hit the hardest are those that are providing care to the people who can least afford it. And we need to keep that in mind as we try and deal with the economic consequences on healthcare in this state.
And do you expect that we will see this will be an issue across the country? I can't imagine that we're much different than any other states. And for example, I believe Florida has the highest proportion of uninsured people under the age of 65. Yeah. So I've got to expect their providers are going to be as bad off or worse than providers in our, in our state.
Yes and no. There will be state by state differences, and a lot of it has to do with whether or not states were participating in the exchange and allowing Medicare expansion. Because what really affects hospitals and providers is providing uncompensated care. And although we in Illinois do participate in the exchange, we did accept the Medicare expansion. Mm-hmm. Even with the Affordable Care Act provisions in place in Illinois, since 2014, we've been seeing a steady rise in the number of people who are uninsured, because those plans are expensive and have high deductibles. And because of that, people have been reluctant to insure themselves. Yeah. That proportion of the population that's uninsured does differ quite strikingly from state to state. Illinois is in better shape than a lot of states on that front, but we still have a big problem with uncompensated care, particularly in Cook County.
Okay. Gosh, thank you. We could do at least an hour on that topic alone. Yes.
Can I, Jennifer, can I say something about testing?
Oh yeah, absolutely.
Oh, thank you. We did learn today. So Illinois only has, the IDPH only has 2 mobile testing sites. So if you're a county like McHenry that doesn't have its own site because of our population, we don't have access to that either. So people in McHenry County either have to go to their doctors, primary care providers to get a test, which you can only get if you have symptoms, or you have to leave the county and drive. Like I went to Rockford to get a test about a month ago. So if we want to talk about opening up, and we were talking a lot about this today, in fact, then having more access to testing is so important. And the contact tracing piece that Marcy brought up, so the COVID money's out there. Counties have gotten money from the state to do this, but it takes a while to get that workforce up. I think the first contact tracing certification course, if I'm not mistaken, was at the end of May. But by the time people go through that course, become certified, get applied, so that is coming. But as Maggie was saying, it's the state that provides that, and the public health departments that provide contact tracing. not healthcare. So it's really also, we have to work together, right? Private and public working together to create that safety net of services. So it's a challenge.
So while you're here in front of us on the screen, will you give us a little bit more on what McHenry County is able to offer its residents in terms of the full scope of assistance on COVID?
So our public health director told us today that she ordered tests back in March, put in an order for a bunch of tests and received five tests total. I think what's happening is we're competing with the private sector. Kids are going back to college now. So a lot of the laboratories like Quest, for example, this is where they ordered them from. They're using those tests where they can get paid more money for it. So I think that's been one of the challenges. We send people to the website. We have 2 federally funded clinics in McHenry County and a 3rd clinic that sees underinsured or uninsured people. Facilities provide some of that testing as well, but that's limited. And doctors will only test if you have symptoms. So I think a lot of times people in our county, or they don't want to pay for the test. So that's the other thing we're running into. The free testing that's available, you have to drive out of the county to get it. So that's our struggle. I really feel like that's one of the barriers for us up in McHenry County is the testing.
Okay. Which is candidly very different from DuPage County, where we do have the testing facility set up and it's functioning pretty well. The delay, except Dr. Nadeem, the delay in results that is happening. I'm gonna just, in the interest of time, I'm gonna move along. Can we talk about children's health and COVID-19? And it's something I think about where should we feel safer when we're around children? You know, if I'm not a grandmother, but you know, if we have a grandmother who has an interaction with her 30-year-old daughter she hasn't seen, she might be a little bit more on guard, but she has an interaction with her 5-year-old grandson and she's a little less on guard. How should we assess the risk from being in contact with children? Dr. Nadeem?
Yeah, so again, great question, because these are the things which we are learning, and moving forward, addressing these issues will probably get things under control. So as long as children are at home, because they were off school, especially the young children, and they are not interacting with kids outside. And if we know about that for sure, then it's, in my opinion, it's safe to interact with those kids. The issue is with the teenagers when they go out and you don't know who they are interacting with. That's where the teenagers, we should educate our teenagers to be responsible. And if, the grandparents have to interact with the teenager grandkids, at least to have some social distancing and mask. For example, we invited, few people at our house. But they are also healthcare workers. So we were sitting more than 3 meters apart. We were wearing masks. We served food in a different way. Instead of hanging around for 3 hours, they were gone in an hour. So there are many ways, as long as public health departments educate people, that could be done. Now, if a school opens an in-person education, that changes, because you cannot. How can you put a mask on a first grader or kindergartner? Just imagining is a little bit difficult. So they might not get serious illness, but they might make their parents or grandparents seriously ill. So as long as, to answer your question, as long as during the summer vacation, if kids are at home and they are not interacting, it might be safe. The real issue is with the teenagers when they go out.
I'd also like to note, there was actually a recent study by the Ann and Robert Lurie Children's Hospital, that children under 5 actually may have 100 times more of the virus in their nose. So while they might not become acutely ill, if they're spending time with older grandparents or older family members, you know, it really puts the family member at greater risk. So definitely something to consider. And as Dr. Nadeem spoke about before, you know, this is a really insidious virus, very unsuspecting.
Yeah, and it is tough for teenagers to say to other teenagers, hey, put your mask on. You feel like you're being the nudge, and teenagers don't want to nudge their friends. It's a really tough situation where that one teenager isn't getting the guidance from at home, you know, from the parents to say, hey, make sure you keep your mask on so your friends don't have to ask, because the friends won't ask. Marcy, are you seeing anything where you're thinking about with the schools planning to reopen, where you've seen good, you know, plans that people are enthused about? I know in my district, it's been a real struggle for almost every school district at both levels, at elementary and at high school, to get plans that parents are, they're just not uniformly on board. Nobody is happy. You know, we can't make everybody happy with these plans. Marcy, are you seeing anything that you're finding parents are happy about with kids heading back to school?
Well, you know, it's a double-edged sword with the kids going back to school. A lot of parents really want that because they didn't sign up to be teachers. And if they're able to work remotely, then they have their day job that they're trying to do and teach. There are a lot of concerns with families with 4 kids, one in primary grade, one in upper middle, one in junior, and one in senior high. If you're doing remote learning, can the family afford 4 iPads? Can the school district afford 4 iPads times however many kids? It's also unfortunate, but for a lot of our kids, and this includes what you would look like on the surface, reasonably affluent areas, a lot of our kids get their main source of nutrition through school nutrition programs. They also get little carry home bags for food on the weekend. They also are someplace where it's a safe place.
Yeah.
It's maybe dad, since he lost his job, is sitting around drinking, and when he drinks, he gets mean. Or mom. I mean, when she drinks, she gets mean. And the kids want to be back. They want to be in contact with their peers. Isolation is really hard for especially middle school and younger high school students. So, you know, it's not a situation where you aren't going to make some people unhappy. Basically, we're making everyone unhappy, and there's no good way out. I believe my district finally made the decision to go to all remote learning through at least the middle of the first semester. I know that some of the McHenry districts have done likewise. So it's how do we create virtual support communities for kids that are safe spaces for them to be, you know, like teenage boys are weird and obnoxious. How do we make that safe and in a way that they can band together virtually? It's a new learning landscape.
Right. Maggie, are you seeing anything different in your district?
I'm seeing a lot of the same things, and in that originally the plan for a lot of local school districts was to have some kind of hybrid program, and they have backed off, at least for the first quarter of the new school year, to remote. And the 2 things that seem to be driving that are, 1, the resurgence in cases, and 2, the logistics of keeping people safe. And because of that, I want to go back just briefly to the discussion that we were having about testing. And that is that I think that what we were talking about in terms of the need of developing rapid testing is really, really essential to being able to keep schools safe. And on a positive note, I just want to note that I had a career before I went into political science and then business research. I was a chemist for a while and I worked at UIC College of Pharmacy. And I'm actually impressed with how quickly we did develop testing from a technological standpoint. We went from doing a technique that takes the slower technique that we've got to the rapid test that AbbVie rolled out very quickly. But we need to do more than that. We need to, at the federal level, basically enlist industry, compel industry to produce more rapid tests machines so that we can distribute them quickly, because that is the key to being able to open schools safely. It is the key until we get a vaccine to opening up the economy.
I'd also, Jennifer, like to comment too on another population that unfortunately frequently goes overlooked. And I've been reading a book called The Death Gap, which talks about how inequality kills, and talking about how access to healthcare, and we have our teachers that are staffing schools, but also there's minority students. Latino students are 8 times more likely to contract COVID, and Black students are 5 times more likely. We really need to protect everybody in our communities.
Yeah, and those are communities that are most often, I don't want to generalize, but more likely to be under-resourced, right? If you're fighting, Suzanne, if you're fighting up in McHenry for testing kits, across our state, we've got supply shortages, and parents are saying, rightfully so, let's get our kids back to school safely. And the big roadblock here is the equipment for safety. And yeah.
Well, COVID has really, magnified the institutional racism that's been going on for centuries, frankly. It's time to do something about it.
Yeah.
Well, I think Maggie made the point, or someone made the point that that the disparity is made so much worse by the public health clinics in underserved areas now not getting that primary care money that they were counting on. It's it is definitely, I definitely agree with you, Jennifer. It's just made it so much worse, or made it so much worse and so strikingly obvious.
Yeah, and I think I would actually say that disparity has always been there, but what COVID has done is shown a light on it. There has been a difference in life expectancies between the west side of Chicago and the Gold Coast for a very long.
Mount Sinai Hospital and Rush Hospital are 2 striking representations of that exact what you're mentioning, Meg.
Exactly.
Absolutely. Several miles away from.
Yes, and it has to do with it. It does have to do with access to healthcare. It has to do with the prevalence of providers in those communities, and it has to do with insurance coverage and the quality of the insurance coverage and whether or not they have it in the first place.
And bringing it back to mental health care, which I almost always do, insurance coverage and completed suicides and disparity of access to care, you can almost trace that line exactly up. It is a striking correlation.
Wow. Yeah. Okay, so heading towards the end of our hour, and we're probably a little bit over. Dr. Nadeem, can you tell us what requirements are going to have to be met for a vaccine to roll out in the U.S.? And then what we're going to, if we can talk about what our state's going to need to do to be ready to distribute a vaccine.
Yeah, I mean, vaccine is, my understanding is that there are 170 companies which are pursuing the vaccines. and some of them are in final phases of trial where participants have been vaccinated. Now they are going to check whether they are going to contract the disease or not to assess the effectiveness, but also safety. Of course, to get the vaccine will require mass production. My understanding is that from news that United States has some vaccines available to roll out once the ongoing clinical trials show effectiveness and safety data. So I think United States should do okay if those vaccines are effective. But I want to caution, because we are assuming that vaccines are out there. Unfortunately, they are not. And in the past, for HIV, there were many vaccine trials done, and they failed in the final phase when it was supposed to save from the illness. So we have to also have a mindset that we might have to survive this illness without vaccine. And there is one extremely important thing I want to point out, because we are talking at the local level. Definitely, everything starts at the local level, but this disease has to be eliminated from entire world. The entire world is so globalized. Let's say United States has 0 cases, but other countries have cases. Is United States going to close its borders for rest of, for many, many years? It's not possible. So if it's not controlled in other countries, it will come back, and it's highly contagious. So literally, this is the thing in which we are all in together, entire world. This is something, we can say whatever we want, but the virus has made us realize that we are, there is nothing first. No country comes first. Literally, all countries are in this together. But to answer your question specifically about vaccine, it remains to be seen. Based on the information which I have, we might, and I trust Dr. Fauci. He's a very knowledgeable guy. I think in the first few months of 2021, we might have effective vaccine. Even if it's 50% effective, it will cut down on the transmission significantly. But I think United States is in good position to roll out the vaccine.
Quick question: when you say with prior vaccines for HIV, for example, that they failed in the final phase, I've been hearing the term we're headed towards phase 3 testing. But is there phase 3 and 4, or is phase 3 our final testing before we get authorization for that?
So some of the vaccines, by understanding, are in final phase, and one of the vaccine which was basically introduced by Russia. WHO and UN has challenged their the way they conducted the trial and everything. But my understanding is that there are some vaccines which are in final phases where you induce the infection and see the vaccine is going to protect or not.
A legitimate final phase.
Yes.
Right.
Okay. I think we should conclude, because we're at our hour, even with our little delay in start. Can I get final thoughts? And we'll start with Maggie, and then just your thoughts on where we are, and then remind people.
Well, I think that the thing to keep in mind is, one way or another, we will get through this. But I do believe that COVID has shown a light on a lot of the failings that our healthcare system has, both in this state and this country, and that we need to learn from this, not only to prevent the same thing from happening the next time we have a new virus that hits, but also to make sure that we have a healthier population that can withstand this type of event again. We need to think about how we structure our workplaces. We need to think about things like making sure that everybody has sick leave, so we don't have people coming to work who are sick. But basically, we need to critically re-examine our healthcare system as this disease progresses, and make changes to make us all safer.
Thank you. And so I'm going to remind people for Maggie Trevor is, for people who are tuning in late, Maggie Trevor is running for Illinois House District 54, and her website is Maggie Trevor, the number 4, Illinois54.net. And Suzanne?
Yeah, I'm listening to everybody, and all that keeps going through my head is right before COVID last year, our public health director did a presentation called Public Health 3.0, and it's the Health and Human Services new way of talking about public health in the 21st century. We need a new model for how we approach this. And I think what COVID has taught us is that we're all connected. Business is connected to healthcare, is connected to education, is connected to the government. Like, it's this web of connection. And much to Dr. Nadeem's point, we live in this global world, so we can't isolate ourselves from it. The more that we look at policy through the lens of how it helps, how it can contribute to everybody, building in equity where we can and making that our goal, I think is going to be really important going forward. So that's my takeaway from the night, and I appreciate this conversation. Thank you.
Thank you. And this woman is Suzanne Ness, and she's running for Illinois House District 66, and her website is citizensforsuzanneness.com. And Marcy?
I think that I echo Suzanne's sentiment. Great conversation. I've learned and thought about a lot from this. I think one thing that's really clear is the absolute importance of electing people who take science seriously. My opponent calls it the China flu and is promoting a very large gathering with no masks. That is the sort of thing that will set us back all the way back to phase 1. We need to make sure that regardless of, whether they're blue or red or green or whatever color, that the people we elect take science seriously, understand that there are policy ramifications to all the decisions, and that there are systemic changes that we need to make going forward to set ourselves up to not go through this again.
Thank you. Thank you. And this is Marcy Solser, and her website is voteformarcy.com. She's running for House District 52. And Jennifer Banek?
Thank you so much, Jennifer. Yep, so just in closing, I liked one of the slogans that I saw that said, just because it's open doesn't mean it's over. So just back to the basics, hand washing for 20 seconds, don't touch your eyes, nose, and mouth, maintain social distancing. I would also encourage people, I see a lot of social media with questionable sourcing. I would encourage people to go back to their county health departments to get good information. The Illinois Department of Public Health, and preparing for this, I was referring to a lot of their sources. Go to reputable sources to get your information and do your decision making. And probably most important, we're all in this together. Look out for one another. Now is the time to exercise our resiliency muscles. We're in this for the long haul. So look out for each other and be kind.
Thank you. And Jennifer is running for Lake County Coroner, and her website is Banek, spelled out F-O-R, coroner.com to learn more about her. Dr. Nadeem, thank you very much also for joining us tonight.
My pleasure.
Dr. Nadeem and our panelists all remind us how fortunate we are to have Sean Casten as our congressman.
Yes.
Talk about a science-based, fact-based leader. I'm very glad he's my congressman, so that's terrific. I'm Jennifer Zordani. I'm running for Illinois House District 47. My website is votezordani.com. I appreciate everybody's time tonight, and my thoughts from this panel are that we really do have a lot of people that understand what we're working for to overcome this virus, and that are united in recognizing the problems in our healthcare system, and that we have to work together really for solutions, because we are good enough to find solutions to these problems. thank you everybody for joining us tonight.
Thank you.
Thank you.
Thanks, it was awesome.
Thank you.
Thank you.
Thank
It was a
you.
good program.
Thank you all for joining us, and thank you, Jennifer, for hosting us tonight and being the moderator for this panel. And thank you to the amazing panel members. We're going to be sending out information about how to get involved with all of these fantastic candidates. These are all great candidates that I would love to represent me. So we're going to send out that information to you all shortly. I do want to plug a few events that we have coming up. So this town hall series that we're doing, this is something that we do on the first Thursday of the month and then the third Thursday of the month. And coming up on August the 20th, we have an education panel, which is going to have a number of fantastic candidates as well as labor leaders and other leaders from the community. So tune into that. It's going to be on Thursday the 20th at 7 p.m. We also have a virtual backyard picnic coming up on August the 30th at 4 p.m. We're going to have great speakers like Senator Dick Durbin, Representative Sean Caston, and Representative Jan Schakowsky for that event. So we hope that you are able to join us for that, or that you're able to join one of our wonderful candidates for phone banking, you're able to donate to their campaigns, or you're able to go out and do any of the other fantastic opportunities that they have coming up. We're going to turn it over to Nancy to close us out. Thank you.
I really enjoyed this tonight, and I think that I agree with Patrick that if all of these candidates win, and if Dr. Nadeem runs for something, we're going to be much better off in the long run and in the short run. So please do everything you can to support them, and please come to our events in the future. I want to thank everybody for coming and listening and participating in our panel. Thank you so much, panelists. We really appreciate it.
Thank you.
Thank you.
Thank you.
We apologize to everyone for the error that happened at the beginning with Facebook. We are happy that those of you that were able to find us on YouTube were able to find us. If you are on YouTube, if you could hit subscribe and hit the like of this video, it will help us to spread our message about various candidates. Have a good night, everyone, and we will talk with you soon.
Thank you.
Okay.
Thank you.